Everyone right to go? Thanks for being here. I want to go through the daily numbers and then I want to talk about some of the challenges that we think are driving these daily numbers, and that may take a little while. I want to go through in some detail some of the data that we have that I think speaks directly to the challenge we face and some of the further behaviour change that people are going to have to start exhibiting. Otherwise, we're going to continue to see growth rather than stabilisation and decreases. So first things first, there are 6,739 cases of coronavirus in Victoria. That's 484 new cases. That number may change tomorrow. Obviously, I think there's about 30 that have come off from yesterday's total in that process that we go through each night. 97 of those 484 are connected to known and contained outbreaks. 387 of those are under investigation. There are now 44 Victorians who have passed away as a result of this virus. That is 2 further deaths overnight. 2 males in their 90s connected with aged care settings. I will again take this opportunity to send our best wishes to their loved ones, their friends and family. This will be a very challenging, very sad time for them, and we send our love and best wishes to them. There are 205 Victorians in hospital, 40 of whom are receiving intensive care. The total number of active cases is some 3,408. To give you a metro versus regional breakdown of that, that's 3,305 in Metro Melbourne and Mitchell Shire, and 103 with 8 more today in regional Victoria. We've done 1,385,964 tests with 24,726 yesterday. Again, can I thank each Victorian who's come forward to get a test. It is vitally important. Logic just tells you we can't trace this, we can't shut it down without people coming forward, getting tested and giving us the data, the intelligence, that very localised knowledge that all of our coronavirus detectives rely upon and that our strategy ultimately relies upon. Now, they are the numbers for the day. In terms of some detailed analysis that we've done overnight around these additional cases and what's driving the fact that we, at best, if you did a weekly average, are seeing some stability. We're not seeing that doubling and doubling again every couple of days. But we're certainly not seeing numbers come down as we would like them to. I want to go through a couple of numbers. There are 3 key points. The first point at which you feel sick. The second point is based on the fact that you feel sick, you've got system onset, you go and get tested. And the third point, obviously, is when you get the results of those tests. From 3,810 cases, which are the cases between the 7th of July and the 21st of July, I'm very, very unhappy and very sad to have to report that nearly 9 in 10, or 3,400 cases, did not isolate between when they first felt sick and when they went to get a test. Now, that's an interesting measure in that people have felt sick, they've got symptoms, and they've kept going shopping, they've kept going to work, they've kept doing, let's assume everybody followed the rules and they only went out for the 4 permitted reasons, which of course some may not have, but let's assume that. That means people have felt unwell and just gone about their business. They have gone out shopping, they have gone to work, they have been at the height of their infectivity, and they have just continued on as usual. I'll come back to why that might be the case in just a moment. But the only thing you can do when you feel sick, the one and only thing that you can and must do when you feel sick, is to go and get tested. Nothing else is acceptable. You must go and get tested when you feel sick. That is the only thing that you can and must do. And if people don't do that, then we will continue to see numbers increase. I'm being as frank, as blunt, as clear as I can, because this message is central to the overall success or otherwise of the strategy and the restrictions that we have in place. The third point is, of course, when you get your results. But in the intervening period, from when you get tested to when your results come through, every person who gets tested is provided with very clear instructions about staying at home and waiting until those results come through. So just to be really clear, a person has symptoms, people are taking too long to go from that point of first onset of symptoms to getting tested. That's one challenge. The second challenge is people then do go and get tested, and we're very grateful for that. But I'm equally saddened to have to report that 53%, or 2,056 of those 3,810 cases, did not isolate, that is, did not stay at home and have no contact with anybody else between when they had their test taken and when they got the results of that test. 53% of people continuing to go shopping, continuing to go to work, continuing to do all sorts of things, even though they've got symptoms, they feel sick, sick enough to get a test, and then somehow not willing to stay at home and wait on average a couple of days, and sometimes sooner, to get the results of that test. Unless we drive down the time between first illness, first sense of symptoms, in other words, how quickly people then get tested, unless we make that much faster than it is now, and people isolate in that intervening period, and unless we have people who get tested staying at home and isolating until they get their results, then we will not see these numbers come down. They will continue to go up and up. And a 6-week shutdown will not be for 6 weeks. It will run for much longer than that. Now, we've spoken a number of times about the fact that many families, because of insecure work, casualisation in our workforce, no sick leave to fall back on. We have spoken many times about the fact that it's not about blaming people for the circumstances they find themselves in. It's not about being critical of people for the circumstances they find themselves in. It's about acknowledging the facts and being clear about those, but then also putting in place a strategy to try and deal with some of the drivers, some of the things that are pushing people to make decisions that they might make a judgment are best for their family, feeding their kids, paying their bills, but are not in any way consistent with the public health across our state, or certainly outcomes for those who will get this virus, a percentage of whom will die. If you haven't got access to sick leave, if you haven't got access to a payment, so to not go to work would mean you are worse off financially, then you've got only one thing to do. Call 1-800 675 398. 1-800 675 398. And hopefully lots of people make that phone call, and it may take a little while for the phone to be answered and for someone to process your claim, but make that call. And if you are working and for purposes of illness, waiting for a test result or a positive result and therefore having to quarantine at home for 14 days, you are eligible for a $1,500 payment where you can't fall back on sick leave. Ultimately, we want a situation where you're no worse off, but every Victorian is much better off because you're not at work, you're not making that very difficult choice between the health and welfare of your family and the health and welfare of every Victorian family. If your bank balance is driving you to make bad decisions, then that $1,500 payment is there. And we will make sure that they are processed as fast as they can be so that people no longer have to make those sorts of choices. But we can't have any longer 9 out of 10 people taking too long between when they first feel sick and when they get tested. And we certainly cannot have 1 in 2 people who are waiting for a test result simply going about their business as if they didn't have symptoms, as if they weren't waiting for a test result, as if this wasn't a global pandemic. We just can't have that any longer. That will continue to see more workplaces with positive cases, more businesses shut down, hundreds and thousands of people isolated at home either as positive cases or close contacts. Ultimately, there's no reason to be going to work when you're sick. That's simply unacceptable. If you have symptoms, the only thing you can and must do is get tested immediately. And if that's going to take you a day or longer, then you have to stay at home for that intervening period. You can't be going out shopping. You can't be going to work. That $1,500 payment is exactly there for you so that you're not having to make those sorts of choices. And again, it's not about being critical, it's about just the facts. And the facts are to have 50%, half of people waiting for a test result when they've been told very clearly that that means you have to stay at home and not be going to work, not be going shopping, not be doing all the other things that are permitted activities, to have less than half of people following those very, very clear orders, that is contributing to these numbers. There's no doubt about that. So it's not about blame, it's not about criticism, it's about confronting the problem. And if you're not prepared to confront that problem, then you've got very little chance of fixing it. That $1,500 payment is there for people who really have, in their own judgment, have no choice but to go to work sick or to go to work whilst waiting for a test result. Those choices, we don't want people to make those choices. 1800 675 398. Call that number and we will provide you with that support so that you can be at home and do the safe thing, the right thing, the thing that is actually in the interests of your family and every family right across our state. People moving around the community when ill, people moving around the community when waiting for a test result, that's in no one's interests. And it will just mean that this lockdown runs for much, much longer than the 6 weeks that we have foreshadowed. I just thought it was appropriate today to be really clear, having done that data analysis over the 2 weeks, which gives us a very clear picture since the stay-at-home orders have been in place across metropolitan Melbourne and Mitchell Shire. They are very stark figures, and they point to some areas where there needs to be a dramatic improvement in people's behaviour and the choices they're making. I know and understand that support is an important part of that, and that's why that $1,500 payment is there. We're doing some further work about whether we may need to enhance that payment, and I'll have more to say about that at the appropriate time. More broadly though, can I again thank people for coming forward and getting tested? That is a really, really important part of our strategy. And can I also thank the vast majority of Victorians who are making sacrifices large and small. They're living a very different life at the moment. This is not the position anyone wants to be in, but it's the reality that we have to confront. We have to acknowledge that, just like this sort of behaviour and these numbers need to be confronted head on, we also need all of us to acknowledge that this is a long way from over. But I am genuinely grateful to everyone who is following those rules, staying at home, only going out for those 4 reasons, and then only doing so when you need to for the things you need. They're not an invitation to be leaving your home. They are a lawful reason to leave your home, but only when you need to. I think that probably sums up the points that I wanted to make. We're more than happy to take any questions. I know the Health Minister wants to speak about masks and infants at some point. So let's do a few questions, then I might throw over to Jenny.
People are working, the people who are not isolating while waiting for their test result, do you know what industries they're in?
There are a number of industries, but we've got some further data analysis to do around that. I think it's fair to say if you look at where outbreaks have occurred, whether it be in aged care, where we have a plan to manage that and to try and cohort workers better, and we're very grateful to the Commonwealth for their partnership in so doing. We've seen a number of meatworks, we've seen a number of significant supply chain businesses, freight logistics type businesses. Again, we're doing some very heavy analysis now and right throughout the night and into tomorrow to try and get the clearest picture of exactly which workplaces we're talking about.
But I think like a precarious worker?
Yeah, I think it is. I think it's probably better to focus on the type of worker rather than the work they're doing. And I think that in the main, it won't be exclusive, but there is a large proportion of these people who are making these choices because in their judgment, they'll look at their bank balance, they'll look at the fact that if they don't work the shift, they won't get paid for the shift, they don't have sick leave. This is a commentary on insecure work. It is a commentary on this as a feature of the Victorian economy and our national economy. That debate, though, can wait. We can have that debate. It's a very important debate to have. We can have that debate another time. In the meantime, though, trying to hone in on the problem, understand the problem, and then put in place specific measures to deal with it. Masks will have an impact, but I want to be really clear. Wearing a mask is not it's not like a vaccine. If you're sick, then whether you've got a mask on or 2 masks or any other PPE, you should not be out shopping. You should not be going to work. You should be doing the only thing that you can and must do, and that is going and get tested. That's the most important thing. But I think insecure workers, and that's where that $1,500 payment hopefully deals with the financial driver, that sense that they have to go and work, otherwise they're simply not going to get paid. Hopefully that $1,500 payment can be a big part of dealing with that underlying driver, the underlying cause. Not of every one of these cases. You know, I think we saw a case of a person travelling whilst waiting for a test result into the east of the state. I don't think that was because they were in an insecure job and had to work a shift or they wouldn't get paid, but I think it's a large part of it.
How soon are we heading in? Sorry, Premier, how soon is it that Victoria will be entering a New Zealand-style lockdown? And can you confirm if your officials have been in discussions with the federal government about a New Zealand-style lockdown?
No, there's no announcements to be made today about any changes to the rules and whether you want to term them, what number you want to put beside the stage, or what country around the world you want to compare them to. That's not the way in which we're thinking. That's not the sort of work that we do. These matters are under constant review based on the data each day, the trends each week, and some of the features that I've just gone through in some detail, understanding the problem. I'll give you one example. If we were to move to a further stage of restrictions where other movement was limited, and I did make some comments the other day about where you might be able to go shopping, how many people might be able to leave the house at any one time, just to give you a couple of examples. Will that stop people going to work that are going to work now? No. So the key factor here, we can't rule those measures out, but at this stage, the key factor here that's driving the numbers and driving our challenge is people that are sick but not getting tested. They ultimately do get tested, many of them, but in those intervening days, they are going about their business with symptoms at the height of their infectivity, giving it to others. Then, of course, there's that second group of people who have symptoms, enough symptoms to go and get a test, which is great. That's exactly what we want. But then the simplest of things, I'm waiting, the mere phrase, waiting for your test result, means just that. You should be waiting for the result, not continuing on as if you hadn't had a test or didn't have any symptoms. It's very simple. They're the things we're focused on. There's no announcements to be made about additional rules or changes. What we want to do is try and drive down the number of days between when people first get sick and when they get tested, and we want to drive up the percentage of people who are at home waiting for their test result, not at work waiting for their test result, or at the supermarket waiting for their test result. These are the pretty simple things, but we do think that financial hardship and insecure work is a big driver, and that's where the $1,500 payment, I think, will be impactful.
Will you make it sense for people to leave their home if they are waiting for a test result, or are you worried that that might create a disincentive for people to get tested?
Well, there are a number of offences under the Public Health and Wellbeing Act. There are orders that are in place. We always monitor those. This is not about threatening people. This is simply about pointing out that if we continue to see this behaviour, then we will continue to see the numbers go up. Now, we face many different challenges. This is one problem. There will be other elements to this, and that's where that data analysis is very important. And if I'm in a position with such clarity to share any of our other challenges with you, of course I will. If there's trends, if there's different cohorts of people. The point you make is a good one, Rachel. I don't want to be disincentivising people from getting tested. The fact that they are getting tested is a very good thing. We just need to get people tested quicker. So less time when you're feeling unwell before you get tested, and certainly no one should be waiting for a test result at the supermarket. No one should be waiting for a test result at the supermarket or at their place of work or anywhere else other than their home. That is the only place that you can wait for a test result, and that's the clear advice that is given to people when they get tested. I'm grateful that people are coming forward and getting tested. We've just got to drive up the number of people who are staying at home while they wait for the outcome of that test.
To clarify though, at the moment there's no penalty for people who are waiting for a test and go to the supermarket or
I'm not
whatever.
entirely sure of that. I'm happy to come back to you. Again, it would be, yeah. Let me come back to you in terms of whether there's a specific penalty that can be applied. I expect some of the we'll get much better outcomes by appealing to people and dealing with the drivers of this, rather than fining people for it. But I'm happy to come back and see whether there's any specific treatment. That's not, I think, the pathway we need to go down. It's about understanding, not blaming, but understanding why are people making that choice. Now, there'll always be a percentage who do it for unknown reasons, and we've seen a few cases like that recently. But to the extent that economic factors, insecure work, financial pressure, and the fact that if you don't work the shift, you don't get paid for the shift because there's no sick leave, if to the extent that that's driving it, I think the payment to the person rather than a fine of the person will be much more effective.
Apply for the hardship fund, and how many people have received it?
I think there's about 1,200 people that have applied. I'm not sure on exactly how many have been processed.
How do you know that?
$100 payment. At the moment, it's only for confirmed cases,
Correct.
close contacts with confirmed cases. So are you expanding that?
Not that I'm announcing today, but I'm having a very close look at whether there are further steps we can take to provide additional support to people in that intervening period between when they get tested and when they get the result.
Can we just ask payment if you're a
Correct.
close contact with a confirmed case?
Yes, which is those who are required to isolate for 14 days. If there's a need for us to go further and deal with that 1 and 2 day period, which is where those 53% of people who are not staying home, they're not waiting for their test result at home, they're waiting for their test result at Coles or Woolworths, or waiting for their test results at their place of work. If we need to go further, we're just doing some further work on that, and if I've got more to say about that, I will. In fact, I'm certain that I will.
Can we ask Brett just for your take on today's figure, and I guess what things like the R number are looking like at the moment? Sure.
Yeah, certainly we're at a really, really challenging phase of this pandemic. I've said before, the second wave, if we are going to call it is very different to the first wave that we've gone through for a whole bunch of reasons. The population's affected, the fact that we're all rather fatigued, we're all a bit inured to the numbers. If we'd had a number of close to 500 in March or April, we would have been staying in our bedrooms and not leaving the house. But some of the challenges in this phase as well relate to the complex environments where cases are occurring, that issue of insecure work. So I think it is absolutely challenging at the moment. The R number has come down from 1.5 to more like 1.2. Other models show that it might be even lower. My suspicion is it's still above 1, and we can't necessarily expect numbers to go down. I think that will be an even greater challenge in days ahead. That means that we're going to look at 500, 600 cases per day. I absolutely don't want us to go there. So we have to reinforce the things that we know will make a difference. And that is the very simple principles of isolation and quarantine. So that issue of getting tested very early in your illness, you're actually most infectious in the first couple of days of your illness. So the very beginning of that runny nose or sore throat or cough or low-grade fever is when you're most infectious. You're probably not that infectious after 7 days. So getting tested very early on and isolating right at the beginning is a really key action. And I think they're things that are not being done so well through this wave as for our first wave. So I think we're in pretty tough times if we're going to turn this around, but we do know what works. And I know that Victorians have stepped up in so many ways, including all the masks that I see now, including the fact that a lot of mobility data suggests that people are absolutely staying home, but there are lots of people who are still moving about, and the most critical ones to reach are those who've got those early symptoms, who need to be at home getting that test and waiting for that result.
Where's the information from? Saying they're not isolating while they're waiting for a test, is that from the app or is it from the interview?
No, that happens through the interview process. So everyone is asked, when did you first develop symptoms? When did you get your test? How many people might you list as close contacts while you're infectious. And so that figure of number of close contacts within and outside the family, and the number of so-called exposure days, so time that you're infectious and out in the community, are those key metrics that we follow. The number of close contacts is decreasing. That's a sign that people are staying more isolated. But the fact that there's still 3 exposure days per person is super challenging, because that means there are 3 days of potential transmission to other people.
And there's been conflicting advice from DHHS about what to do. I've seen a form from the 17th of May 2020 that sort of says, what should I do while I'm waiting for the test result? And the advice from the government and the health authorities, if you are feeling well and you do not have any coronavirus symptoms, you can continue to work and go about your usual activities. Well, has that contributed to the situation that we're now in?
No, I don't think so. So people who are going to our testing stations now should be symptomatic. There are some very specific settings where people without symptoms are getting tested, but you are 40, 50, 60 times more likely to have coronavirus when you're getting a test with symptoms. There are some settings where we know aged care, meatworks, other explosive outbreaks, where we know we need to test people who are asymptomatic, because they are very likely to have been exposed and therefore be in the pre-symptomatic phase, so we can pick people up before they develop symptoms. But broad asymptomatic testing in the community does not pick up cases. When we've done our blitz, there have been half a dozen cases out of tens and tens of thousands. So they are not the individuals who are any more at risk than any other asymptomatic individual out there.
One of the biggest weapons we obviously have in play of this pandemic is contact tracing. We know that there is a significant backlog. Parts of Victoria have been in lockdown for, almost 3 weeks now. I guess, how do you, or is there an ability to bolster your contact tracing team, and how would you go about doing that?
So there's no specific need to bolster our contact tracing team. It is huge, over 2,000. The bottleneck is not in outbound calls. We could get through 1,000 cases if we had 1,000 cases today. Our Health Direct staff who are now onboarded are numbering their hundreds. They can each do 5, 10 interviews. So we can do interviews. The complexity is in all of these settings where outbreaks occur, and managing all of the difficult circumstances of those outbreak settings. So that's an ongoing challenge. You can throw people at it, and we've got people working on it, but the real challenge is not to have those outbreaks occur in the first place. And the key element there is to isolate at the first sign or symptoms of coronavirus. For example, in aged care, we've got as many staff who've become positive with coronavirus as residents. That is a huge challenge, because every one of those staff members is potentially passing it on to residents, and the residents are the most vulnerable, and that leads to the outbreaks that we're seeing.
So how long's too long to get a call? Because there's a lot of anecdotes of, I waited 4, 5, 6, 7 days, kid in my class, a kid in my kid's class had it. We haven't been called. How long's too long?
We would absolutely aim from the time that we've got receipt of a positive result to phone people in the first 24 hours. What people sometimes do not recognise is that they will be notified directly by the pathology provider that they're positive. We only know about people when we have received that result in the department. That doesn't necessarily happen at the same time. So when a medical practitioner calls us, then we know. When a pathology service passes on that result, then we know. But that path slip does not say this is someone in a sensitive setting. This is, someone who's at a workplace, or in an educational setting, or at a meatworks. If we're doing an outbreak response, we'll know that, and we'll compartmentalise those results and we'll get them directly. But for people who are going to drive-through testing sites, we don't know the settings that they're in. And so it is important, if you're getting that result yourself, to do the right thing, isolating immediately, as we said yesterday, to list the close contacts that you know, to have their details down. And so when you get that call for an interview, you can provide all of those results. But our metrics are absolutely to contact people in that first 24 hours.
So one of the issues pathology providers not providing positive or negative results to you sooner?
So there is an automated process for individuals to get that SMS notification. For pathology providers, they will have a bulk number of thousands of negative tests and a number of positive tests that come through. That is not necessarily as timely as for the individual being notified. But again, I don't think that's problematic if someone who receives their result does the right thing. The other thing we know is that for maybe a third of the people we're following up on a daily basis, they're not picking up the phone. So if you're getting that unidentified number, that may well be the Department of Health and Human Services. If you've got a result and you know you're positive, we are trying to contact you. So please answer the phone. We will continue to try and contact people, but sometimes if people say they haven't been contacted, it's because they haven't picked up the phone because they don't recognise the number, or because it's a private number that's coming up. We'll work on other ways to engage with those individuals, including prompting for a door knock. But I would urge everyone, especially if they're aware that they're a positive case, if you're getting a phone call, it may well be the department trying to work out all of your close contacts, getting them captured in the system, and then getting an automated message and following up with phone calls for all of those individuals.
Are the delays acceptable? Like, are you okay with the delays, or do you need to make it?
No one would be happy with a delay in terms of identifying close contacts. So again, if people can pick up the phone, we know that we'll get those details earlier and we can follow up with those close contacts. If people already know that they are a case, they can go through the process of detailing all of those close contacts, and indeed contacting them if they're comfortable and confident in doing so.
If you have a positive case and they haven't answered the phone, what is the time between someone going to their door, between an unanswered phone call and someone turning up on their doorstep?
We're going through a process now to try and refine exactly how we'll do that. We've got, as you know, additional ADF personnel who might even assist in that process. But a follow-up phone call from our call centres is the most appropriate one to just keep trying people. But we are working through a process now where we would aim for a knock on the door on the same day for that very reason, bring down the exposure days that someone might be infectious.
Protocol too little, too late, because we've had triple-digit growth for the last 3 weeks.
We have always tried to contact people at the earliest possible time, but we are looking at where particular issues arise and trying to address them as we see where the contribution to transmission might occur, and so putting the word out that people absolutely have to isolate when symptomatic is not a new message, but we're focusing on the fact that it's not been sufficiently addressed and we need to keep hammering that home. We'll do that for any other message that we think is relevant to transmission.
Just on high-risk settings, given what you've said, is there a need for a directive to stop people working across multiple high-risk settings, be that meatworks, be that aged care providers? Is there a way you can do that to try to minimise the spread in those settings?
Yeah, essentially not a directive, because there are always reasonable excuses, or there are practical impediments to stop that fully, and they will be very particular to a setting or an industry. But the WorkSafe inspections and the WorkSafe checks on businesses and the general policy direction that we're providing to all workplaces is absolutely to minimise your movements across any of the settings that might be part of that workplace. So that is an important feature. There are some industries, some settings where it's practically impossible, but we want it minimised to the fullest extent possible. And as you know, we've worked with the Commonwealth on aged care and really minimising the movement of people between facilities.
Do you know what the numbers are on where people are catching it? Like, is it 40% work, 30% home, and 30% you don't know? Do you know what the breakdown is?
We know that for outbreak settings that there's a significant contribution in aged care, in healthcare, in those large indoor settings, and in large apartment settings. So they're significant drivers, but there are a number of other workplaces that will have transmission occurring.
So this is mostly work?
Mostly work or health or aged care. But we can't always determine exactly where someone's gotten it from. We do know that there's a significant reduction in household-to-household transmission. That's absolutely a result of the restrictions that have been in place.
Just to go back to the question around New Zealand-style lockdown, considering the vast majority of the cases are through workplace transmission, is there a need to impose stricter lockdown measures?
So everything is under consideration. But again, to go to a particular model of lockdown that worked for one country at one point in time is not the solution. We have to understand what the dynamics of transmission are in Victoria at this point in time. It may well be that it's an awful impost on the economy and on people's lives with no material benefit if we go to a New Zealand-style lockdown. We have to understand where the transmission's occurring and what measures will be most effective in reducing it.
Have you got any stats on... Oh, I've got 2 minutes short goods.
Sorry, I just wanted to clarify the nature of the transmission we have going on at the moment. Would a New Zealand-style lockdown be enough to, suppress the numbers even more, or would it be unnecessary because people are still going to have to go to work?
Well, I certainly wouldn't even assume that a New Zealand-style lockdown will address the issues that we have. Obviously, people were very constrained during that 4-week period in New Zealand, but New Zealand didn't have significant community transmission. Again, they were identifying the close contacts of international travellers, and it was a much more straightforward contact tracing process, as it was in Victoria through the first phase. So I wouldn't make assumptions that harder, more constrained lockdown is necessarily the way to go. We have to be targeted in terms of seeing where the issues are and addressing them directly.
Have you got any stats on aged care? Oh,
If I
sorry.
can just add to that. Let's be really clear on the challenge we face. 9 out of 10 people are sick but are taking too long to get tested. That will drive transmission more than anything else. What's more than half of those who've gone for a test are not staying at home while they're waiting for the results of that test. That will drive transmission pretty heavily too. So if we want to talk about trying to order all the different challenges that we face, and when you're having to try and contact trace thousands of people, not every one of which answers the phone when you'd like them to, not everyone is necessarily as fulsome in the information they provide as you'd like, all of those things, that is but a fraction of the challenge that is posed and the transmission that is directly relatable, directly connected to people feeling sick but not doing anything about it, and instead actually going to work, the supermarket, going and doing normal, ordinary things. And certainly, if you've got symptoms sufficient to prompt you going and getting tested, if you then go about your business, and you, as I said before, if you're waiting for your test result at Coles or Woolies, or you're waiting for your test result at your place of work, that'll drive transmission. That'll drive transmission really significantly, and it is a far higher order issue and problem than any of the other matters we've talked about today. But the thing is, the good thing about that is it's within our own control. If you feel sick, get tested, and get tested quickly. Then while you're waiting for your result, wait for your result at home, away from other people, not at the supermarket, not at work, not anywhere else. You've got to stay at home and wait for that result, and we'll get that result to you as quickly as possible. And if it is a positive, then we will get to you as fast as we possibly can to give you advice, to give you support, to get from you the list of people that you think you might have been close to in the relevant period, all that usual work. Let's not today lose sight of the 2 key points, and that is people are waiting too long once they feel sick to get tested, and we'd ask them to come forward quickly when you've got even the mildest of symptoms. And secondly, while you're waiting for your test result, you've just got to do that at home. You can't go anywhere else. It's just not safe for you and everybody else if you're out shopping or going to work. You just can't do it. If financial issues are the challenge, there is that $1,500 payment, and we'll get that to you if you're eligible, if you haven't got sick leave, as quickly as we possibly can.
Can you just clarify on that payment? Do you only qualify if you get a positive test? Because that's what the DHHS site
At this
says.
stage, yes.
You need to change that?
Well, as I indicated earlier on, we're having a very close look at whether there might need to be some additional support for that waiting period, the period of once you've been tested and you're waiting for the outcome of the test. But I'll have more to say about that soon.
Premier, have you been meeting with Commodore Hill at all, and has he got any sort of advice for how Victoria might...
Commodore Hill, I think, had a meeting this morning, a final meeting, if you like, just trying to get a system-wide picture. At 10 o'clock this morning, I'm speaking with him this afternoon. I've had a very good conversation with the Prime Minister last night about a whole range of different issues, and I agreed that I'd let Commodore Hill get his planning finished before he was asked to come and brief me. But I'm pretty sure I'll be talking to him and a whole range of other senior people at the department about the overall setting. We're very grateful we've got almost the full number of ADF support. There'll be a few more to come, but we've got almost the full number, so they've really been quick, which is terrific. As well as the Health Direct people from Medibank, some other private sector workers, the Ambulance Victoria paramedics who can't work on the road but are working for us, doing a fantastic job. So I'll speak with him later on.
Do you anticipate more military coming in or more support from interstate?
Well, what I can anticipate is that if we need them, we'll ask for them, and the Prime Minister will say yes, and that's probably the best way to answer your question. In my discussions with the PM last night, I think we've got the people we need, but if that changes, if we need more, then we won't hesitate to ask.
On prisons, considering the release of any low-risk prisoners, and also how concerned are you about people in detention in lockdown?
I was asked this the other day, and my answer hasn't changed. That is not a focus of our attention at the moment. In terms, I think the Corrections Commissioner, she's made some comments this morning about the preventative abundance of caution lockdown of a number of correctional facilities, I think 6 in total. I'd let her speak to the details of that. This is a challenging environment. We've always known that there was the potential for somebody connected with this unique environment to be positive, but that's as I'm advised, that is a purely precautionary measure, and I think the Corrections Commissioner is doing a good job there and has been clear about why she's done what she's done today. If there's any further updates in those settings, I'd leave it to her to update you.
Back on the hardship fund,
Sure.
on average, what's the time frame between someone applying for the fund and...
I'm not certain, Samara, and I think that we'll have to, double and triple our efforts there, just in terms, because I think we'll probably get more of those calls. That's not a commentary on our performance. It's just, I think, to try and make that as fast as possible, then that may be an area where we have additional resources. Because I think if you can all make this a feature of your bulletins and your columns and your work throughout the day and in coming days, that point about if you're sick, get tested quick, and if you're waiting for a test result, go home and stay home, you can't go to work, you can't go shopping, and that number, 1-800-675-398, I think that will drive traffic to that, and that'll mean people aren't motivated by financial hardship to make a bad choice. Instead, they'll be making good choices in the interest of everyone.
And then he's going to target communication towards cold communities,
Yeah,
for
we are.
example.
We are, and I just on masks, I just want to make a comment. You just reminded me in terms of targeted communications. There's a team in my office, a team at the department that speak with a very, very long list of people every single day. The big supermarkets are very keen that I get the message out around mask wearing for the safety of their staff, for the safety of other customers, and to keep stores open so that there's no issue about supplies of food, or no greater issues than we might otherwise expect. You need to wear a mask if you're going to the supermarket, and you may well be turned away if you turn up at your Coles or Woolies or IGA and you don't have a mask on. It's a small thing. Our nurses and doctors wear coverings from head to toe. It is not too much to ask people to wear a mask in order that they don't find themselves in hospital or contribute to somebody else finishing up in hospital. And for the sake of people, particularly in those indoor environments, I think the supermarket is a fantastic example of exactly where the mask can have a very significant benefit. Our big supermarkets wanted me to mention that today. They're working very hard on distancing, on cleaning, on all of those processes. I think they'd ask and I'd ask that customers play their part. Beyond that, though, we have enormous amounts of communications effort, direct connection with community leaders right across multi-faith communities, multicultural communities, every age group, workplaces as well. So speaking to workplaces, not just those public-facing ones like supermarkets, but warehouses, abattoirs, the list goes on and on. It's a big team and they're working very hard.
Would you consider locking down postcodes or certain suburbs if these numbers continue to rise and if people continue to flout the rules?
Well, again, I wouldn't focus on people flouting the rules. There are some people who are doing the wrong thing. There are some people who may be motivated because of financial hardship. There may be others who are just making really silly choices. I'd leave it to Victoria Police to follow them up, and we've seen some pretty spectacular examples of people just not doing the right thing. But I don't want that to detract from the fact that so many Victorians are doing the right thing, and we're very grateful to them. In terms of when we're in a position or when we need to make further announcements about rules, we will do that. That's what we've done all the way through. Obviously, these numbers. Well, you're asking me a hypothetical question and then wanting me to put a timeline on it. Ultimately, when the data tells us we need to go further, we will. Until then, speculating about these things doesn't serve any real purpose. The most important thing for every single Victorian: follow those rules, only go out for the 4 permitted reasons and only when you need to. If you're sick, get tested quickly, and while you're waiting for a result, wait for the result at home. Not at the supermarket, not at work, not anywhere else other than in your home. And if we all do that, then we will see much better numbers than the ones we're having to report at the moment, because the data data tells you exactly what you need to know. 3.1 exposure days per case, so more than 3 days of high infectivity before you go into ISO in your house. 9 out of 10 people waiting too long, so they've got illness but they haven't got a test yet. And then, of course, perhaps the worst of all those statistics, more than half of those who have taken a test and are waiting for a result are not waiting for that result at home. They're going about their business. We can't have that. We've got to drive that number much, much higher so that we've got a percentage in the 90s where people are waiting at home for the results from the lab.
What people should expect from contact tracing, there are dozens of kids at the Trinity School in Colac. They've been told by the school that they're close contacts. They haven't been contacted by the department, the school says, and they're going off to work. So what should those kids expect from contact tracing if they've been told they're close contacts?
Well, I'll need to follow up on that individual example, Raf. I don't have that to hand. But again, there is a very large team of people, and they are making literally thousands and thousands of calls, text messages, emails, every effort that can be made. It's a big team. It's got bigger in recent weeks. It could need to get bigger again, and that's why we've got plans to train up additional people. But again, I would just stress to you that hours or even 24 hours between getting a test result and getting a call is nowhere near as impactful as people going to work while waiting for a test result. A test result that for the vast, vast majority is not an asymptomatic or pre-symptomatic test. It's a test prompted by the fact that they had symptoms. So you had symptoms enough to get tested, you went and got tested, that's terrific. So grateful to you. It's a wonderful thing that so many people are coming forward and doing that. You've just got to stay at home until you get the results.
Can you say that schools are still safe, and how do you reassure teachers with a number of 482 today?
Well, what I'd say is that the settings in relation to Year 11 and 12, VC and VCAL students in Year 10, specialist schools and the supervisory arrangements for children of parents who can't work from home, all of those settings, it's not a function of decisions made by me. They are decisions I've made, but they are made on the basis of advice from our public health experts. And if the advice were different, I've been criticised for closing schools. I've been criticised for keeping them closed. All of those decisions were based on the best public health advice and the current settings. So Year 11 and 12 and those other cohorts I mentioned being at school, but 700,000 kids not being at school, are based on the best public health advice. If it were to change, then of course our settings would change. But
Making it compulsory to test all workers at high-risk industries like abattoirs or distribution centres.
I think I'd take you back to some of the comments that Professor Sutton just made about the differences between asymptomatic testing and symptomatic testing. But having said that, we have done in aged care, for instance, in some meatworks, and in a number of areas where there's been significant outbreaks or where we deem those settings to be at a higher risk, we have done blanket testing. We've literally tested everybody. Now, you don't find very many. Sorry?
blanket testing the industries? So
Oh.
every meat worker or every worker who works at a distribution centre, regardless of whether there's been an outbreak there or not?
I think we'd have to take some advice on that and look at the proportionate cost. And when I say cost, I mean we've only got so much lab capacity on any given day, and we wouldn't want a situation where we were testing people who had a very low probability of having the virus. And again, a test is only a snapshot in time. It's not like it's a passport to being illness-free that you can then carry around with you for a fortnight or a period of time. The very next day you could become infected. So you've always got to make those difficult judgments and try and balance it out. But look, we have done blanket, for want of a better term, we have done blanket testing in some settings, and if that was deemed an appropriate measure, then we wouldn't hesitate to do it again. I don't think it'd be industry-wide, but it might be an entire workforce. That's something that might be needed in the future. But again, we can do 20, 30 odd thousand tests a day, maybe a few more with some interstate support, but we'd have to be careful not to be doing a lot of work where it's most likely not at the expense of, for instance, doing surveillance testing of symptomatic people in regional Victoria, for instance.
Back to masks, can people expect police outside supermarkets enforcing these bans, or who will be enforcing the no mask, no shop type situation, and how strictly will police be enforcing it, given we've had the lead up?
I think it's probably best if Victoria Police speak to the individuals, or the steps they're going to take, the policy response and some of those very operational matters. I'd leave it to them to speak to that, and we might get someone to come out and do that for you later on this afternoon.
What did you make of the
But let me just finish on masks though. I would hope that it's not a matter of me telling you to do it or Victoria Police fining you if you don't. It's a simple thing. It's an easy thing, and it makes a big difference. And for those people who have it but may have incredibly mild symptoms or no symptoms at all, it is invaluable. That's where we're at. With the amount of community transmission we've got, it's a different situation than it was last time. It's a different situation than it might be in 3 or 6 months' time. But right now, it's a small thing, but a really powerful thing that people can do. And I would hope that there was no need to be enforcing these things, that it was simply people doing the right thing for themselves, for their family, for their community, and for every single family.
But what about the person who doesn't want to serve the customer? What do you say to that supermarket worker? I mean, my son works in a supermarket. He's worried that someone's going to come in. Is he going to?
At the moment,
should he tell that person to wear a mask? What should that person do?
Well, Raph, at the moment, you've got supermarkets, for instance, just to use that example, because it's a very important one, that have hand washing protocols upon entry to the store. They have distancing protocols throughout the store. There's not a police officer in every aisle. So supermarkets as businesses who are required to maintain certain standards, they are enforcing those things. And I support them saying to anybody who decides that they're not wearing a mask and they don't have a good reason for it, that they're not coming in. And that hopefully that is not the case. There's no reason for that to be the case.
You're asking too much of the supermarket workers.
I don't believe we are. We're already asking them to make sure people wash their hands. We're already asking them to make sure people stay 1.5 metres apart, etc., etc. They are doing a magnificent job, and I think all of us have a newfound respect and a newfound gratitude for supermarket workers, perhaps one that was not a typical feature. If we'd have been asked to do our top 10 workers in the economy, many people would not have included supermarket workers in that top 10. They pretty well do now, because they've done a mighty job, and I'm grateful to all of them. The least we can do is protect them and protect the store staying open. If there's a positive case, if you're not wearing a mask, if you've got it, if the virus gets into that store will be closed. There'll be deep cleaning, there'll be all manner of impacts, not least of which on you, because you won't be able to go and buy the things you need when you need them at that local supermarket.
Authorities have stepped into St Basil's aged care home in Faulkner. What do you know about that?
I think there were so many staff that had tested positive or were close contacts that there needed to be a supplementary workforce put in there. And that's what, Samara, I think that's why the partnership that Jenny has with Minister Colbeck, that I have with the Prime Minister, that the respective public health teams have. Aged care is a really challenging setting, particularly private sector aged care. But whether it's face masks, cohorting workers, taking patients who can't be appropriately, residents I should say, who can't be appropriately cared for in place to a tertiary hospital, all of those steps, they will bring a sense of control to aged care. But as well as some of the issues I raised earlier, so many of these workers are casual workers, and we're grateful to the Commonwealth for their support through their hardship, their workforce fund. I spoke to the Prime Minister about this last night. We think that that'll be a real boost, so that those workers are not missing out on getting paid for a shift because they didn't work the shift, or when you do all the rejigging of rosters, there might be less shifts because they're consolidated to one place rather than working for multiple employers at multiple sites, which is deemed far too high risk in terms of exporting the virus from one setting to another.
But how many?
Sorry, just one at a time.
Sorry.
That's all good.
Sorry, for Victorians who haven't been able to get a mask, will there be a government rollout of masks, and how will that work? When
There
we
will be.
start?
Well, a couple of points. It's a very good question, but the first thing is it's not just masks. It is face coverings, a handkerchief, a bandana, a scarf. Any covering is better than no covering. And again, if people accept that this is something that, yes, it's a small contribution, you may not enjoy it, but ultimately there's nothing enjoyable about being in intensive care or having someone you know and love in intensive care, or having workers in intensive care subjected to this virus. It's a small thing, and I ask people to be generous in the way they wear a mask. Do the right thing by your family, your community, every community. It is not, in my judgment, too much to ask. There will, on the second point though, face coverings, so it's just not just masks, it is face coverings as well. The second point is we'll have more to say very, very soon about the first of our massive order of masks, reusables, and where they'll be distributed. I think I gave the example the other day, we're doing some further work on this. GP practices, particularly for perhaps older people who might not have the opportunity to get out and buy a mask, or others who may not have the financial wherewithal to go and buy a mask. There'll be the best, more than 2 million masks, the first order of which comes in this week, and we'll, in good time, we'll be able to give you an update on that.
How many cases have we got in aged care residents now, and how many clusters are we dealing with?
There are 45 aged care settings that have positive cases. There are 383 positive cases in connection. As for a breakdown, I think it's roughly 50-50 staff to residents, roughly. Even though we're a bit later today than normal, the show release will come out later on this afternoon, and that'll give you all the breakdowns you need.
Where do the numbers have to be on masks? Sorry, where do the numbers have to be on masks for you to feel comfortable that we no longer have to wear them as a mandatory program?
It's far too early for us to speculate on when masks will no longer be required. What I can say is they'll be required for so long as they make a real difference. If we can get virus levels to such a low point that they're deemed not necessarily of any use any further, then we wouldn't be asking people to wear them. But I think masks are going to be a feature not just of this second wave, but they will be a feature of preventing a third wave and everything that comes after that. This is not where we wanted to find ourselves, but it is our reality. We need to not only comply with all these rules, but we need to embrace this as a critical step towards getting to a normal, a COVID normal. And if we all do these things, then we will be closer to that end point than ever.
What did you make of those last night on 7:30 report?
That's about 5 questions at once. I could try it. I can thread them all into one if you like, but right, we'll go over here first. Bridget.
Some doctors say there's too many exemptions for masks, and they've had a run-in of people with asthma contact them for exemptions, even though it's controlled. What's the message of those people?
Now, I've got a couple of asthmatics in my house. They're all wearing masks. That's not to say every asthmatic is the same. I think that people need to engage in this in the best spirit. So we have seen some reports of people selling masks for toddlers and babies. That is simply not on. Toddlers should not be wearing masks. Kids 12 and up should be, but under that age they're not required to, and babies and toddlers should not be wearing masks. Do not buy those products, do not use those products. Well, there'll always be a debate, and it's not an unhealthy thing. Whenever you grant exemptions, whenever you draw a line, and there are groups on either side of it, I think we've got that balance right. If at some point we need to change that, if people were using exemptions to undermine the integrity of the overall system, which hopefully we want, the vast majority of people, when they're out for a lawful reason, when they need to be out, are wearing a mask. The supermarket is a fantastic example. That's just exactly the sort of setting where wearing masks will be critically important.
At St Basil's, how many
Yes.
residents have been diagnosed with COVID-19 and how many staff? And
Sure.
do we know how the outbreak started?
All of that can be contained in the show media release later in the day, and if there's a follow-up we need to give you, we will. It's not just about positive cases though. There'll be a bunch of staff who will be close contacts as well. They may never get it, but they have to be away from work, and when you take an entire workforce out of a facility like that, that's where a second workforce is very important, which I think was the original question.
So we'll see a lot more federal authorities stepping in aged
Well,
care
I
settings?
would say, well, how you want to term it is a matter for you. This is a sector that's regulated, funded and run by the Commonwealth. This is private sector, for-profit and some church and charitable aged care. This is not the 180 odd public sector aged care facilities that we run. They're run as part of health networks. They're in a different place, but it's not about who's responsible for what. We're all in this together, and we're working really closely. And again, it was a feature of my discussion with the Prime Minister last night. That plan will work in pulling it up in aged care settings. But those numbers I spoke to before, the number of people who are sick but not getting tested, then tested but not waiting for their results at home but instead going to work, a bunch of those will be aged care workers. Let's not judge them, let's try and work out what's driving it. And I think that financial hardship and insecurity of work is a really big factor in it, and that's why the payment and perhaps some tweaks, some additional announcements I'll make very soon will be an important part of that.
Can we just ask Jenny about people who shouldn't be wearing masks?
Yes,
Before we
certainly.
do, sorry,
Sure,
Premier,
yes.
what did you make of claims on the 7:30 report last night from a security guard who claimed she was recruited from WhatsApp and not given any training and had to be away on the PPE?
I didn't see 7:30 report last night, but I have seen a report of that program. What I'd say to you is we've got a retired judge, counsel assisting, a strong budget and very broad terms of reference to deal with all of those matters and many more. And it's not my intention to be cutting across that in any way. What I made of it is that there's a need for a judicial inquiry. That's why I've set one up.
Last questions, please.
Any more for me or
Yes,
Jenny?
Can I ask you about community sport?
Yes.
How much money can the government keep pouring into local community sporting groups, and how important is it to keep them alive through this pandemic?
Well, there has been some assistance. I'd have to get an update from you. I'll fully confess that that's not been at the top of my list. I know it's important, it's very important, and it is functioning in regional Victoria to a certain extent, not so much in metropolitan Melbourne and Mitchell Shire, and that's very painful for a lot of people, not just as a leader but as a parent. In our own household there are sporting activities that would have been going on this winter that aren't, and that just brings it home for you that it's not just a line in a brief. It's not just notional. It really is. It's really impacting people across the board. I've spoken with, for instance, with John Wiley at length as the head of the Australian Sports Commission. There are a number of smaller sporting codes and bodies at a state level that without membership income. And of course, if you're not playing, there's every reason to suspect that people won't pay their subs. Also, a time of economic hardship, maybe people don't have the financial wherewithal to pay those subs. We'll need to do more here. We have done some things. I'm happy to get you an update on exactly what we've done. I haven't got I can't quite find the figure at the moment, but I'll come back to you about that. But it's a significant issue because it's about keeping communities together. It's about keeping people healthy and fit and well, and it's a sense of normality, but it's not conducive with stopping the spread of the virus at the moment.
Just on the pay rise public servants have received, why is it appropriate for them to receive a 2% pay rise in the middle of the pandemic when they're...
Well, we negotiate in good faith, Samaya. We negotiate in accordance with the government's wages policy. This deal, this agreement is out for the consideration of relevant workers. Union goes out for a ballot. We'll have to wait and see what their view of it is.
Most other jurisdictions, including your Labor counterparts in Queensland, though, have imposed wage freezes on the public sector workforce in a situation where a lot of private sector workers don't have jobs at all or are facing, losses of businesses. Wouldn't that be a sensible move to freeze wages?
I've got no such announcement to make, and what other states do is entirely a matter for them.
And how will you be paying for the pay rise rises, will you borrow the money, or has it?
No, we'll deliver a budget at the end of the year, and the accounts of the state will be there, clearly understood by everybody at that point. We have had a very significant revenue write-down. That's logical. We've got significant expenses that relate directly to the pandemic. We have been urged by some people, or at least one person, to run a budget surplus, and we've been criticised for not doing that. The sort of cuts you'd need to make to hospitals and schools and to our pandemic response, if you were to try and do that, would make no sense at all. The Governor of the Reserve Bank has been very clear with us. We need to build and we need to invest, and we need to be perhaps more focused on household budgets than we are on immediate repair of the state budget. We'll deliver a budget at the end of the year. The Commonwealth Treasurer, I think, has made it very clear that they're borrowing to get to the other side of this. All states and territories, in fact, all nations around the world are doing just that. But in terms of the specifics of any measure, all of that will be brought to book when the budget is handed down by the Treasurer. And that'll outline not only how we've paid for the things we've had to do, but it'll also outline our plan for jobs, for strength, for the recovery that we are all committed to making sure we can enjoy.
How do you feel this morning with the 484, the number?
Oh, look, it's not about how I feel. Every day is another challenge. Every day is the beginning of a lot of hard work. And that's not just me, that's the team that I lead. This is thousands and thousands of people working day and night, doing their very best. Nothing is ever perfect. Nothing about this virus, this pandemic is perfect. It's very challenging, but I'm proud of them and they're working very hard. And I simply got up and acknowledged that today'd be another hard-working day. That's pretty much the story of 2020.
To clarify regarding the pay rises, so Victoria will most likely need to borrow money to
No, that's not
pay
what I
for
said
the
at
pay
all.
rises?
No, what I said to you,
I wanted to clarify.
Sorry?
Nothing.
What I said was that rather than giving you a line-by-line accounting of every expense across the entire public sector, we deliver a budget each year. We will do that later in the year, and that's where those sorts of issues can be canvassed in the proper context of seeing all the accounts of the state, all the revenue, all the expenditure, and all of our priorities to get us to the other side of this and to make sure that jobs and skills and prosperity and recovery are at the centre of everything that we do, just as it has been for these last 5.5 years.
Just on aged care, will
Certainly.
you be moving all sick residents into hospitals now, or considering doing that?
That's done on a case-by-case basis.
Will you be changing it that all sick patients get
No, it'll
transferred?
continue to be done on a
Why
case-by-case.
won't you consider changing it?
Because it's done on a case-by-case basis based on medical advice. For me to stand at this podium and say, right, we're going to move everybody out, not because of a medical opinion, but because I think that's a good thing to do, that doesn't make any sense. We will wait and see on an individual case-by-case basis. I've got some experience in a previous life about these matters. Moving frail aged people out of nursing homes is not a good thing to do unless you absolutely have to. That's just something that those in this sector know and understand very well. If you can't get the care you need in your home, and it is their home, it is the place where they live, if they can't get the care that they need in their home, in that aged care facility, then they'll be moved. And there'll never be any limiting factor to that. But where doctors deem that's not necessary, it is very disruptive, it is very traumatic to have people who are frail and older moved to an unfamiliar environment. It's very, very challenging. That's not a value judgment, that's just the fact, and it's been the fact for a long time.
Can I just ask Professor Sutton a few questions for you? That's okay.
Any more for me?
Just want to ask one on hospitals, but
Sure.
maybe one for...
I knew there'd be one. It's all
I just
good.
wanted to ask, do we know how many people, hospital workers, are currently in self-isolation?
Let's come back to you on that. It is a significant number, and that's a product both of transmission in healthcare settings, but it's also a product of, with the amount of community transmission we've got, there's people that are connected to the health system. And when we say health workers, a bit like the supermarket point I made before, it's not just surgeons, it's nurses, ambos, doctors, no matter what specialty or what part of the hospital they work in. It's orderlies, ward clerks, cooks and cleaners, car park attendant, it's the whole team. They're doing a great job and they are at higher risk, and that's why if you value their work, if you If you think they're heroes, then do the right thing, because that'll mean less Victorians finish up in hospital and less health workers, the whole team, will finish up sick.
And just given that there is a significant number, do you envisage maybe looking interstate to recruit people to come in and help us out?
I wouldn't rule out, if we got to a point where we needed support from other states, then we'd ask, and I'd be very confident that we would get it. Just as we do every fire season, we'll often send specialists as well as general duties people, if you like, so whether it be volunteers or paid staff, as well as others who can do command and control work. We do that for other states, they do it for us. This is public health bushfire that we all have to bring under control. Just before I throw to Brett, I would just take this opportunity again, in the spirit of your question, just to acknowledge that we do have significant support from other states and territories. We're grateful for that, of course, from the Commonwealth, uniformed and non-uniformed, and we have many other partners, private sector partners, different government agencies that probably never thought they'd be anywhere near a public health response, but they're all pitching in and working very well, and we're grateful to all of them, and particularly grateful to those who have released them from their normal duties to come and assist us at what is a very, very challenging time. The last question is for Brett, correct? Yep.
A number of regional mayors and communities have called for regional cities and centres to also be locked down. Is that something that you would support, or is it actually necessary?
So there are about 100 regional cases at the moment. It's a small percentage of the total number of active cases in Victoria. We will consider, as we do every day, what the numbers show, and if there's any requirement to extend the restricted area beyond Metro Melbourne and Mitchellshire. I just want to say on the issue of masks, you will see some people who aren't wearing masks. A number of them are legitimately not able to wear masks, so please don't vilify individuals, or don't make the assumption that they are simply stubborn and refusing to wear masks. There will be people with medical, behavioural, psychological reasons not to wear a mask. Certainly don't make an assumption that they should be the subject of your ire.
And another question, how old is the youngest COVID patient?
I don't know the youngest COVID patient in Victoria at the moment. We have had patients hospitalised in their 30s. I think it's similar in New South Wales at the moment. There should be no assumption that you can't be hospitalised or indeed in intensive care or at risk of dying just because you're in your 20s or 30s. It has happened, and there are significant numbers who've been young and very unwell, or who've died internationally, with the huge numbers that have been seen.
Do we have a great proportion of young people who have contracted coronavirus just because of the way transmission is working in workplace settings, for example?
Certainly for those under 10 years of age, they make up a small proportion, a couple of % of our total numbers. So for the very youngest, we know that transmission is much less likely and that illness is much more mild. For those who are teenagers, or 10 to 19 years of age, there's a few more %, but it's a relatively small proportion of the total.
Anything else?
Yeah, just a question to
Sure.
the hotline number that was given out, we called it, and it doesn't actually provide an option for those hardship payments. So what are you doing to make it easier for insecure workers to make the right decision?
Sure. So the issue of income security will be able to be addressed when people get that phone call from DHHS. They do the contact tracing. They get provided with all the relevant information. That can be an opportunity for people to raise that issue at that point. But if there's a need for that to be done through the automated buttons, we'll have a look at that as well. Can I just add just one further pointer, that we are all accustomed to soldiering on during winter when we've got cold and flu symptoms. We have to move away from that. You're doing no favours to your work colleagues by going to work whilst you're sick. In fact, you are potentially putting them at grave danger of contracting coronavirus. So this is a winter like none we have experienced before. It is so so vitally important that people stay at home if they're experiencing even mild cold and flu symptoms and getting that test for coronavirus at the earliest opportunity. The pathology labs turnaround for the last week have been averaging 1.8 days, so it is a relatively quick turnaround. I know for many of us who go and get our annual blood checks done with our doctor, typically you'd be waiting several days for those pathology results to come back. So it is, a small thing, a small sacrifice to make, to wait patiently for a few days to get that pathology result. You should be staying at home until you know whether you are positive or negative and you have that clearance. And you should be certainly staying at home if you have even mild symptoms. And please go and get tested at the earliest opportunity. We are making it so much easier for people to get tested. We have so many testing stations now, more than 160 of them right across Victoria, and we're opening more of them each and every day.
What about people, sorry, just final question, people who get cash in hand, so obviously that's a discussion to be had for another time as well, but they're not, registered in any system, they get cash in hand, will they receive a $1,500 hardship payment?
Yeah, so this is designed to enable people to access financial support where they can't access leave entitlements. So that'll be a discussion that'll be had with the department. We are not asking people to present tax returns or, go through onerous steps to satisfy us about that payment. We're working incredibly hard, including today, to get that message out to the community that that hardship payment is available to them, and it is there really to make sure that there is no discouragement there from people making that hard decision about whether they put food on the table or they stay home and recover from coronavirus. That hardship payment is designed to ensure that people do the right thing and do the right thing by their family and their work colleagues and stay home and recover as is a legal requirement. So there's nothing further?
Is that all?
Thank you so much.
Thank you.
That's yours.